Pediatric voice disorders. Some background information. The reported incidence of childhood voice disorders ranges from 6% to 23%, with benign vocal fold lesions reported to be the most common cause. The length of the vocal fold is equal in both males and females until the child is about 10 years old, and then after this, males experience a significant amount of vocal fold growth. During the assessment, we want to give standardized questionnaires, which are typically given to the parent or caregiver and reviewed by the voice team. We also want to take a medical history to see if there are any diagnosed congenital disorders or any surgeries that would impact voice, as well as an environmental history to see what are their living conditions, are they exposed to tobacco or allergens, is there any professional vocal use such as singing or acting. For time of onset, we want to know if dysphonia was present at birth, which is associated with a congenital pathology or a neurologic cause, or was it acquired later, which can be caused by trauma or infection, and then a physical examination of the structures should be done. Some common voice disorders include vocal fold nodules, which are the most common cause of dysphonia in children. They affect more boys than girls. They're fibrotic masses located in the mid-portion of the vocal folds. The exact cause is unknown, but they're thought to result from vocal abuse or misuse. Voice characteristics include intermittent hoarseness. Treatment begins with vocal hygiene, voice therapy, and behavioral management. Vocal fold cysts can either be congenital or acquired. They cause dysphonia by increasing the mass of the vocal fold and impairing glottic closure. They usually do not resolve with voice therapy. Anterior glottic webbing can be congenital or acquired. It can be asymptomatic or can cause dysphagia by interfering with the airflow or by impacting glottic closure. For this, surgery is a viable treatment plan and can be done either endoscopically or via laryngeal fissure. Other congenital abnormalities include JRRP, which is the most common benign neoplasm of the larynx in the pediatric population. Onset is typically prior to age 12, and boys and girls are affected equally. The chief vocal complaint is hoarseness, but children also present with stridor or respiratory distress, and this can be treated surgically. Vocal fold paralysis refers to vocal fold immobility secondary to disruption of the motor nerve, which supplies the larynx. This can be unilateral or bilateral. Stridor is the most common symptom, and treatment will vary depending on presenting symptoms. Finally, we have functional dysphonia, which occurs in the absence of structural or neurologic laryngeal pathology. Causes include vocal misuse, maladaptation following respiratory infection, increased laryngeal tone, compensation for glottic insufficiency, or psychological and personality traits. Perceptual features include a strained strength of vocal quality, distorted pitch, and reduced loudness. Treatment is often centered on rebalancing glottic behaviors to produce a normal voice. Here's my reference. Thank you for watching.